Classification of bones. Bones are categorized based on their shape and function into following types: long bones, flat bones, short bones, irregular bones, specialized bones. Okay. Long bones. They are cylindrical in shape with enlarged ends. You can see. So these are the long bones, cylindrical shape with, you can see, the enlarged ends. Clear? What you will find here, you will find a tubular shaft or diaphysis enclosing the medullary cavity filled with the bone marrow. So this part of the bone is called the shaft, diaphysis. Inside this you will find the medullary cavity containing the bone marrow. And the enlarged ends, they are called the epiphysis or articulation. So function, they support, they help in the movement, they help in the weight transmission. Example, humerus, femur, long bones. What are the regions of a long bone? You will find diaphysis, epiphysis, metaphysis, epiphyseal, cartilage. Diaphysis or shaft. Okay. So the central tubular part. Okay. So the central tubular part of the long bone is called the shaft or diaphysis. Okay. It is made up of the thick compact bone. So inside this you will find a medullary cavity containing the yellow bone marrow. Okay. It gives strength and reduce weight. Okay. So this part is called shaft or diaphysis of the bone. This part, the central tubular part. Okay. Inside this you will find the marrow cavity, medullary cavity. Inside that you will find the bone marrow, mainly the yellow bone marrow. Epiphysis. Now the ends are called epiphysis. Okay. So this one is called the proximal epiphysis, and this one is called the distal epiphysis. And here you will find the spongy bone, trabeculae and red bone marrow. Here you will find. Okay, they contains red bone marrow. Types of epiphysis. Pressure epiphysis. They transmit weight, like femoral head, humeral head. Okay, so this head of the femur. So the head of the femur is a type of pressure epiphysis. Traction epiphysis, found by the muscle pull, like trochanter of the femur. Okay. Atavistic epiphysis. They are the remnants from evolutionary point of view. Coracoid of the scapula. Coracoid of the scapula. Metaphysis, located between the diaphysis and epiphysis. Okay, you can see. So this is the epiphysis and this is the diaphysis. So this area. So this part of the long bone is called the metaphysis. It is the site where new bone is formed, contributing significantly to the lengthening of the bone. Epiphyseal cartilage, growth plates. You can see this one. Okay. In immature growing bones, a plate of hyaline cartilage known as the epiphyseal cartilage separates the epiphysis from the metaphysis. Okay. So this area is the metaphysis, epiphysis. Between them you will find the epiphyseal cartilage. This growth plate is responsible for the longitudinal growth of the bone. Okay. The longitudinal bone growth is due to this epiphyseal cartilage. As long as the cartilage remains active, the bone continues to increase in length. There are some important points here, like modified or aborted long bones that lack a medullary cavity or where it is reduced or absent. For example, clavicle in the dogs, rabbit and fowls, and ulna of the horse. Miniature long bones, small size long bones, the typical long bone structure, metacarpals of the dogs. Elongated bones, some bones though long in shape but they don't have the medullary cavity. Example, ribs. Then flat bones. They are broad, thin, expanded in the two dimensions or the two direction structure. Two layers of compact bone with a layer of spongy bone dipole in between them. Is in the flat bone you will find two layers of compact bone, outer and the innermost. And in between those two layers of compact bone, you will find a layer of spongy bone that is called dipole. Function: they provide protection to the internal organs, offer a broad surface for muscle attachment like scapula, cranial bones. Short bones, roughly equal in dimensions in their length, width and thickness. Okay, you can see the carpals and the tarsals. Mainly composed of spongy bone with a thin outer layer of compact bone. They are mainly composed of what? Spongy bone On the outside, you will find a thin layer of compact bone. Function: they help in absorbing shock and diffusing concussion. Carpals and the tarsals. So these are the carpals bones. These are the tarsals bones. Okay, carpals and tarsals are the short bones. Irregular bones. They are complex in shape. Irregular, do not fit into any categories. Structure: they consist of spongy bone covered with a thin layer of compact bone. Function: vary depending on the location. Okay, often involving the support, protection, or the muscle attachment, like vertebrae, bones of the cranial base at the base of the cranium. Then some special types of bone, like pneumatic bones. They contains air-filled cavities called sinuses. They make the bone lighter. They assist in respiration in case of poultry birds, okay, or voice resonance in case of mammals. Example: in birds, humerus of fowl communicate with the air sacs. Okay, in mammals, you will find the sinus in the frontal bone, maxillary bone, ethmoid bones. Okay, sesamoid bones, small seed-like bones formed within the tendons. They form after birth. You will not find any Haversian system and periosteum. You can see the patella bone. Okay, they act as pulleys, reducing the friction. They modify pressure or direction of the tendons, like patella. Okay, this is the patella. Then visceral bone, splanchnic bone. They are also called heterotrophic bones. Bones located within the certain soft organs, viscera. Example: os penis. Okay, in the penis of the dog. You can see this is a line diagram. So this is the penis of the dog. Inside you will find a bone. Okay, that is called os penis. Os cordis in the heart of the ruminants. Os opticus in the orbit around optic nerve from birds, for example in the owls. Os rostrale in the snout of the pig. Os phrenic in the diaphragm of the camel. So this is a summary table for you.